massage as we put it into our bodies, okay? So this is just breaking down 1, 2, and 3 even further. So this is ACTH dependent, and this is ACTH independent. Not that I'm doing just, two's not important, but you pretty much get that. It's a tumor somewhere else in the body. So I'm going to focus on 1 and 2. This is answering one of your objectives right here. So ACTH dependent Cushing's syndrome, excess ACTH causes bilateral adrenal hyperplasia, and then because of that, increased adrenal production of cortisol. So you're just bombarding it with ACTH. So it's really lifting weights a lot. And it's just getting huge, bulking up, bulking up, bulking up. Because it's hyperplasia, it's abnormal, it starts to overproduce. The etiology and pathophysiology is listed below that in more detail. So again, that ACTH, that abnormal level of ACTH, it can be produced by microadenomas in the pituitary. We mentioned that yesterday. Macroadenomas. Individuals with MEN type 1 syndrome, we've introduced that to you here and there. Ectopic ACTH syndrome. Oh wait, there it is right there. Tumors of the lung, sorry, it is number 2, it's right there, I apologize. Tumors of the lung, pancreas, thymus, they're secreting it. And then in rare cases, you can actually have tumors that secrete CRH. So one of them even higher in that whole ladder. So CRH is elevated, which increases your ACTH, right? You can actually take ACTH. So if you took too much of it, you could obviously have an increase there. So ACTH dependent, it's what's causing the issue, specifically. I'm just looking at something. So this one's different in that it's not, that's one's ACTH independent. It's not, ACTH is not causing the problem. And again, the best example I can give is the COPDers who are putting a lot of steroids, cortisol, into their body. So what does the body naturally think? It gets all this elevation of cortisol steroids. What do we know about our negative feedback loop? Your body doesn't know. It's like, whoa, 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 whoa. We don't need any more of that. I'm going to shut down what? It's up there. Negative feedback loop. So if you're getting too much cortisol, glucocorticoid being produced, it's going to shut down what? Somebody say it out loud. It's right there on the slide.
CRH.
But even before CRH.
ACTH.
Yeah. But yeah. So that's why this is ACTH independent. Because the issue's not coming from the ACTH. And in fact, in some instances, it's actually shutting it down. It's really important you understand that. If there's a test question over this. You can read that, but again, the one is taking in large amounts of glucocorticoid. So history, things they complain about. This one is different in that they're not skinny, they're not little. These individuals are overweight. They are larger. And again, if you understand what those hormones do to your body in those 3 layers, you'll know why they're presenting like this. You'll understand it better. So, weight gain, issues with the blood pressure, muscle weakness, menstrual changes, irregular period, decreased libido, they bruise easy, they have mood changes, and they have changes in their skin. Cushing's syndrome has some funky stuff in it that will really help you differentiate it from the other diseases. I'll try to point those out to you. These people have central obesity. So they're not big all over. They're large in the middle, and it looks like I think I've told you this before, it looks like you took grape and stuck toothpicks in it for arms and legs. I mean, that's the best way I can think of it. They have a very weird thing. It's a dorsocervical fat pad, and it's right here. They call it buffalo's hump, which is horrible. I don't know where that came from, but you'll hear it. And now that you know, you'll be like, oh my God, I've seen that on people. It's right here. Like, you know, you can see most people, that little bone, you know, you see your spine's process. It sits right here. I have a picture of it. So next time you're a good shepherd, you're back there listening to their lungs. And that's why you do a really good survey when you do your other components of your physical exam. You'll be back there and you'll notice it. You don't have to tell them, you don't have to feel them, you can document. You know, increased dorsocervical fat pad. You have a picture in there. Plethora is odd. It's a weird word. Essentially, it means they get this red, ruddy complexion of the face. Just redness right there. Ooh, I just put myself in the nose. Not like a rosacea face. You know, you've seen rosacea. Or like a mylar rash with SLE. It's just an all over redness. Look like they went out and ran 10 miles and came back in. They have a facial rounding, they'll say a moon face, and it's just this round face. It's kind of odd. These folks get striae or stria, you'll hear it pronounced both ways. That's deep, thick, purple stretch marks, essentially. They usually get them in their abdomen. Acne, proximal muscle weakness and wasting. I had a doctor found this and Dr. Pittman on this once. Yep, I remember them all. But they'll tell you the answer and you'll be like, I'll never forget that the rest of my life. If you know anything about steroids, then you'll understand number 6. When people take a lot of steroids, it affects their proximal muscles. Not distal, so they can do this all day long. It's these muscles that become weakened. And I had a doctor ask me that. He's like, people take a lot of steroids, what does it affect, proximal or distal muscles? I was like, I had no idea. It's proximal muscles. So they have issues standing up out of a chair because you gotta use your quads and stuff to get up. So just remember that. Why that is, I have no earthly idea. So I can't look it up. Issues with blood pressure, hypertension, and poor wound healing. Much like your diabetics, they have issues with poor wound healing because of the increased sugar. These people, if you go back to your, let's see here, don't go back to it, I'll tell you. Slide 10, under description of what cortisol does, it has anti-inflammatory and immunosuppressant properties. But because theirs is all funky and jacked up and not doing correctly, and because of the sugar, they have issues with wound healing. Or wound healing. Any questions over that? We'll get to some some pictures here in a second. So we're gonna work these folks up. Get a urine pregnancy test. Anytime a woman, if it's a female patient, they come in with fatigue, weight gain, any issues with amenorrhea, I could have put that in the Addison's disease lecture as well. Pregnancy test. I don't care if they come in with any time, I just get pregnancy tests. I love me a pregnancy test. I do them all the time, but I do though, because if I'm gonna give them a medication that could potentially be harmful, I'll get a pregnancy test on, just before I give it to them. It's easy, it takes 2 seconds to get them. You don't have to tell them you're doing it either. Well, I mean, you don't have to tell, I mean, not that you're doing anything wrong, you're just, trying to help them out a little bit. More peace. If an ER doctor ever comes to you and they say, what do you want to order, just say pregnancy test. I want a pregnancy test, you got chest pain, pregnancy test. They'll be like, you're right, that's a good job. Okay. So serum glucose, you're going to check that. CBC, there's not a lot of funkiness there, you may have a leukocytosis on it. CMP, they could potentially, which is just kind of weird, I know they could have an issue with their potassium, but it's just a regulatory process. The body gets funky and starts trying to kick stuff out. Don't get too caught up in that, but I just want to tell you what you would see if you did order it. You could potentially have low potassium. You could get a late night salivary cortisol test. I know everybody's like, what the heck? That lecture that you're going to get that I put together last year for the second year students, it goes into major in-depthness on all of these tests. You can also order a 24-hour urine-free cortisol. So for 24 hours, the patient collects their own urine, brings it back to you, then you test their cortisol levels. Because you do lose, cortisol is actually in the urine. The literature says, and that would be your Greenspan, dexamethasone suppression test is, I hate saying first line, but that's usually what they're gonna order. That and the 24-hour cortisol. I'm sorry, yes, 24-hour urine-free cortisol test. Just read this. Because if you gave them, what is dexamethasone? So if you gave them, because what's increasing these folks? What's too much of? Definitely steroid, cortisol. So if you gave them the dexamethasone, what would you expect it to do? If it was what would you expect that to happen?
Negative feedback.
It would suppress it, right? It should in a normal individual. But in these folks, it didn't do it. And again, this is a whole clinical picture. This is starting out with those, let's say those two tests, if you had a really high index of suspicion, and then ordering more to try to piece out where you're at with primary, secondary, and tertiary. And that's what the last bullet point is. The CRH test. So it takes measurements of ACTH levels to differentiate ACTH dependent from ACTH independent disease. And again, I know right now, unless you go back to that slide, you're like, I can't even remember what those two slides said. You can go home and read this and look at it, it'll come together. But if you remember from those slides, what independent and dependent causes were, that'll make sense to you. Because if you gave them CRH, what would you expect ACTH to do? Right, in a normal person. I always think human being, like there's other things out there. A normal person, sorry. But you look at the number of your ACTH after you give them the CRH to see where it's at. Is it elevated, is it normal, or is it low? And that helps you determine where the mess up is at. Imaging, much like with the other stuff we've already talked about, if it's an issue with the pituitary, you get the brain. If it's an issue actually with the adrenal gland, you get a CT scan. If you feel like it's a tumor that's somewhere that's a malignancy, they're going to do a malignancy workup. You're going to CT scan whatever area you're concerned about, or do a PET scan. The treatment section is here, because again, Dr. Latassi will cover that section. If it is a tumor secreting, you go and you remove the tumor if it's appropriate. Much like we talked about with acromegaly. You go in and you take away what's causing the damage. It's interesting there though, following up with hormone, much like the thyroid, once you take out something, just always remember, if you get other tissue that secretes important things, you gotta put back whatever you took out. So you're gonna have to put these people on lifelong replacement for mineral or glucocorticoids. Differential diagnoses, obviously obesity, diabetes mellitus, metabolic syndrome. If you remember metabolic syndrome from your cardiology section. And then complications from it. The complications for osteoporosis, avascular necrosis, again, that's because of basically the steroids just swimming around in their body. And that's something else I've also told you guys, I think, that you have to be very cautious with steroids because that is a common, bless you, side effect. Not common, but a potential side effect from steroids is osteoporosis and avascular necrosis. Avascular necrosis, very particular in 65 and up, 65 years old and up. It is a potential problem if you give them steroids. Be mindful of that. I was about to panic. I was like, oh my God, I didn't put any pictures in here. I'm an idiot. Here's your buffalo. There's your striatum and your stretch marks. There's the round face. This isn't the greatest picture in regard to the plethora because it's kind of a dark picture anyway, I apologize. But she does have a ruddiness to her cheeks, her nose, her chin, a little bit above her brows. But do you see that round face look? Now again, there are probably lots of people that have faces that look like that, that you're like, oh, they all have Cushing's. No, it would be other signs and symptoms that go along with it. But I'm telling you right now, if you go into primary care, family medicine, you will see people with Cushing's syndrome because of steroids. You'll see it. Okay, the last part is really basic. Why don't you guys go take a couple of minute break and come back